Hi, I'm Alan, and I live in Raleigh.
So Al, tell me this. When you very first came in here, what was your major complaint?
Major complaint was that my back was hurting anytime I stood for any length of time, for example, preparing meals in the kitchen, or even walking any particular distance. About the longest distance I could walk without pain was down to the mailbox in my house and back. And then I had to sit down and rest for about 5 minutes before I could get up and do anything else.
Well, and how long had that been going on?
Oh, gee, that months, probably dating back to 2016 when I was working out in the gym, and first my knee gave out and then my back started hurting, and after that it was all downhill until I saw you, and we went through the disc decompression therapy, and that has worked wonders for my back.
Well, fabulous. I was going to ask you. Well, then what did you tell me just a little bit? Now, you're still carrying the cane, but just for safety's sake.
Just for safety's sake, because of the knee.
And what other things did you try to do to get this handled before you came here?
Basically, I went to an orthopedic surgeon. They didn't do an MRI, but they did x-rays, and because I had had a total hip replacement done, and they wanted to make sure that because of the complaint of the pain in the back, that I wasn't messing up that new hip implant. So several x-rays indicated that the hip implant was perfect and it hadn't moved or done anything bad, but still I was left with the pain, and they really couldn't do anything at that point in time. And I had already done disc decompression on my neck back in 1994-95.
That's right.
And that worked out very well for me. So I was pretty well sure that if I came to you, that disc decompression would help me some extent. I just wasn't sure it was going to help me as much as it has.
Oh, fantastic. I love hearing that. And you're older now than you were in 1995.
Oh, yes. A little bit.
What is your age?
I'm 80 and 3 months.
Oh, fantastic. Well, it sounds as though you would recommend spinal decompression.
Oh, absolutely. Absolutely.